Hello everyone, this is Taylor of Rejuve Medical Fitness. Today's video is going to be about high intensity interval training, or more specifically the Tabata protocol. So high intensity interval training, also known as HIIT, is a very popular type of training as it allows exercisers to get a very effective workout in a relatively short amount of time. Actually, a typical HIIT workout is about 5 times more effective than a traditional cardio workout. So you can essentially get the same results in 5 minutes of doing HIIT training versus 25 minutes of running or jogging on the treadmill. So that probably sounds too good to be true. Well, fortunately it is true. And in fact, our new rehabilitation program utilizes a form of HIIT called the Tabata protocol. So the Tabata protocol was actually developed by a Japanese doctor by the name of Dr. Izumi Tabata, and what he found is that you can get an extremely effective workout in just 4 minutes as long as you push your body to its maximum. So specifically, the benefits he found was that Tabata was great for burning fat, increasing your cardiovascular capabilities, and it was also great because it was convenient and flexible. The thing is with this type of training is, yes, it is quick, but it is also quite uncomfortable. The goal of this type of training is to really push our body to its limits. We want to really challenge our cardiovascular system and put stress on the body. That stress is what signals our body to adapt, grow, and become healthier. So yes, it is challenging and it's difficult, but that is the cost of greatness. So the way that Tabata runs is it is a 20-second round of max intensity effort followed by 10 seconds of rest and recovery. You would do that for 8 rounds, which is going to equal about 4 minutes. So the way that we know we are pushing ourselves to our max for those 20-second rounds is that we should not be able to have a normal conversation, because all of our effort should be devoted to the exercises and we should be breathing heavily. Even during the 10 seconds of rest and recovery, we shouldn't be able to talk at all because we should be using that time to recover and get ready for the next round. So with Tabata as well, it's very flexible. You can use lots of different techniques. I usually would like to use moves that are more full body and engage a lot of different muscles, because the more muscles you recruit, the more energy it takes, and that makes the Tabata harder, which is what we want. So just keep in mind that each Tabata is going to look and feel different for everyone, because everyone is at a different level, and it really does come down to how much you push yourself. So I'd just like you to try your best and put your best effort into the Tabata and really push yourself to those limits. It does definitely take some time to be able to learn how to overcome those mental barriers that really stop you from pushing yourself. But you'll get better at it over time as you adapt to it and build more resilience. I'm not saying that you should push yourself to the point of exhaustion and passing out. That's not really the goal of this, but you do need to push yourself as much as you can within reason. I'd just like to also quickly add that consistently performing Tabata protocols is very challenging because Tabatas are designed to be uncomfortable. So it does take a lot of dedication and mental fortitude to get through a lot of them. So having a coach such as myself to verbally motivate you and keep you on track does provide a lot of value. It helps to keep you on track, help you keep going and not give up. So just very quickly, remember that if it doesn't challenge you, it doesn't help you grow. So just got to keep that in mind with Tabata protocols. Alright, so I'm just going to take you guys through an example Tabata routine. I'll give you some modifications because you can definitely modify the techniques that you're using to make it suit you. So if I just grab a chair for example here, the first technique I'll show you guys for Tabata is a squat technique. So if you are just getting started or you're not too sure, you might want to get started with just a sit to stand version of the squat. So for example, for your 20 seconds, you're just simply sitting and standing, and you can use that chair to sit in every single time. So you'd have 20 seconds of that, and then you'd have a 10-second rest where you can catch your breath, keep yourself moving a bit. If you are a little bit more advanced than that, you're at the intermediate level, you could do the sit to stand, but you could add a little bit of a jump at the end of that movement. However much of a jump you are comfortable with. And then if you are advanced past that, you could just simply do a squat jump. 1, 2, 1, 2. For your 20 seconds, keeping it at a nice, quick pace. There you go. So that would be your first technique. You could do that for 4 rounds, and then you would switch to a different technique. So the second technique I'll show you would be a jumping jack or a jumping jack variation. So if you're at the beginner level, you could just do a jack step, and this would be at a nice, quick speed. Very good for people that have problems with their knees or who don't want to jump. For a little bit more advanced than that, you would just go into a jumping jack. Once again, nice quick speed. 20 seconds of that. And if you're at the advanced level, you could do a lateral jump, which would look kind of like that. A lot more advanced than the other levels. Once again, you would do that for your 4 rounds, 20 seconds on, 10 seconds off. Okay, so hopefully that kind of gives you guys an idea of what the Tabata protocol is all about. This was just an explainer, so if you did want to see a follow-along routine, you can see that in one of my other videos. So please check that out and make sure to give us a like and subscribe if you enjoyed learning about the Tabata. We will see you guys in the next video then.